So the next 10 important questions for nursing officers exam. The 31st question is the condition in which the bleeding is so irregular, the condition in which the bleeding is so irregular and the excessive that the menses cannot be identified is known as. So the bleeding is irregular and excessive and cannot be identified, that is known as, right answer is D, menometralgia. Menometralgia. We should know the other options explanation. Option A, menarrhea. Menarrhea means heavy bleeding or prolonged bleeding with menstrual cycle. Menarrhea means heavy bleeding or prolonged bleeding with in the menstrual cycle. It can be occur in menstrual cycle. Option B, metrorrhagia. Metrorrhagia is irregular or frequent bleeding, but it not be heavily, irregular or frequent bleeding, but it not be heavy bleed. That is called metrorrhagia. Option C, polymenorrhea. Polymenorrhea is denotes regular bleeding at interval of less than 21 days. Menometrorrhagia is regular bleeding that is happen in less than 21 days. So next question is 32. Roberts sign is found in. Roberts sign is found in. Right option is C, IUFD, intrauterine fetal death. Roberts sign found in intrauterine fetal death. We can see Roberts sign in intrauterine fetal death. So other options, option A, placenta previa. In placenta previa, bleeding will be occur. It is a painless bleeding. Placenta may be located over or near the cervix. Placenta can be seen in the near cervix or over the cervix. It is called placenta previa. Next option, abruptio placenta. In abruptio placenta, we can see painful bleeding. It is a difference between the placenta previa and abruptio placenta is placenta previa is painless bleeding. Abruptio placenta is painful bleeding. So in abruptio placenta, painful bleeding can be occur. So bleeding may be painful and placenta is partially or complete detached from the uterus. So placenta can be separated or detached from the uterus, partially, maybe complete. So that is called abruptio placenta. So next option is option D, hydatidiform mole. Hydatidiform mole is non-cancerous tumor. So hydatidiform mole is non-cancerous cancerous tumor. It is partially degenerative. And proliferative changes in the chorionic villi. It is partially degenerative and proliferative changes in the chorionic villi, and the result in the form of cluster of small cysts of varying size. It's like a grapes in the size. Size. So next option, question number 33. Internal rotation of the fetal head occurs during the labor. So internal rotation of the fetal head occurs during the labor at. So we have before that we have answered this question. We should know the mechanism of labor. so we can attend this question. So you should all should read mechanism of labor. So right answer is option C, outlet. So internal rotation of the fetal get occurs in the outlet. So question number 34. Fertilization of two ova released in the different menstrual cycle is known as fertilization of two ova. So two ova is released from the different menstrual cycle. It is called fertilization occurs two ova released from the different menstrual cycle. It is called, right option is A, superfetation. So superfetation is fertilization of two ova released in the different menstrual cycle. So second option B is superfecundation. In superfecundation, fertilization occurs of two or more ova. So fertilization occurs of two or more ova from the same cycle by the sperm from the separate sexual intercourse. So in the superfecundation, fertilization occur of two or more ova from the same cycle by the sperm from the separate sexual intercourse. So option C, fetus papyraceus. Fetus papyraceus is looking like mummy in like fetus. Fetus papyraceus, mummy like fetus in multiple gestation of pregnancy. In which one fetus is dies and become flattened, one fetus is dead and become flattened between the membrane of the fetus and umbilical cord. So in fetal papyraceus, multiple gestation means multiple babies are there in the uterus, but one baby will be dead and it should look like flattened between the membrane and the fetus and uterine wall. Question number 35. During the phase presentation, attitude of the head will be. Right answer is C, complete extension. So during the phase presentation, attitude of head is complete extension. So in that question we should know what is the partial extension and deflection and flexion. So in flexion, option D, in flexion, so vertex presentation will be there in flexed position, in flexed attitude. Vertex presentation will be there. So presenting part will be acciput. So option B, deflection. In deflection attitude, bro is the presenting part, and bro is the presenting part. So next is shoulder presentation. In shoulder presentation, acromion process is the presenting part. Presenting part. Otherwise it may be a scapula. So question number 36. What is the full form of HELLP syndrome? So here one HELLP syndrome detail is denotes its option D, hemolysis. H means hemolysis. Elevated liver enzyme. EL. So E means elevated, L means liver enzyme, and another L. So one L is missing in the HELLP syndrome in that sentence. So another one is low platelet level. So one is low, and P means platelet level. So right option is D, hemolysis, elevated liver enzyme, and low platelet level. So next question is 37. What is the antidote of magnesium sulfate? What is the antidote of magnesium sulfate? Right answer is B, calcium gluconate. Calcium gluconate is the antidote of magnesium sulfate. Usually magnesium sulfate we are using in the gestational hypertension. So who is inventing Caesar during pregnancy? Magnesium sulfate used in the gestational hypertension. So right answer is B, calcium gluconate. So option A, protamine sulfate. Protamine sulfate is antidote for heparin. Protamine sulfate is antidote for heparin. Then option C, calcium carbonate. Calcium carbonate usually used in the those patients less in calcium level in the blood. Option D, sodium carbonate. Sodium carbonate we can use in the acidosis patients. So sodium carbonate used for the correcting acidosis. Question number 38. A suspected pregnancy is confirmed by the presence of HCG in urine or serum after how many days of missed period? So we can see the HCG hormone in the urine or blood after the how many days of missed period? So we can see as soon as possible, at least 8 days. So after missed period we can see 8 days of urine or blood. So at least it should be 8 days after missed period. So question number 39. During delivery, on vaginal examination, palpation of the fetal blood vessels lies in front of the fetal presenting part through the intact membrane is known as. So right answer is D, vasoprevia. Right answer is D, vasoprevia. So we should know the other options detail. So first option, cord prolapse. Cord prolapse means descent of the umbilical cord. Cord prolapse means descent of the umbilical cord through the cervix and rupture of the membrane. So here in cord prolapse, rupture of the membrane present. So membrane of the sac is ruptured. So rupture of the membrane in the cord prolapse. Then cord presentation. In cord presentation we can see the presenting part is umbilical cord. Presenting part is umbilical cord. So then placenta previa already we have seen. So question number 40. The nurse is carrying the client who has spontaneous abortion. The nurse is caring for the client who has spontaneous abortion. For what complication the nurse should assess? So which complication nurse should assess in the spontaneous abortion? So everyone should know that most common complication of spontaneous abortion is, right option is A, hemorrhage. Right option is A, hemorrhage. So then option B is dehydration. It's a severe loss of water content from the body. Dehydration is severe loss of water content in the body. And then option C, subinvolution. Subinvolution means failure of uterus return to the normal size. Failure of uterus return into the normal size after the delivery. After the delivery, the uterus will not be returned for that normal size. So option D, hypertension. Hypertension means that is increased blood pressure. Increased blood pressure. Hi guys, if you like this video, please like and share to your friends. Thank you.